Sherry, thank you for engaging in this conversation with me. Clearly, you are very, very experienced, very skilled, very empathic. I really enjoyed watching you in this exchange. And I wanted to ask you, what did it feel like for you talking with this mom?
Watching the actor and her expression and how she reacted to the questionnaire, I think my real feelings really started. I did feel empathy and expressed that genuinely, because she did such a good job in her role play. But it other than that, I was comfortable.
Mm-hmm. And your body language in terms of responding to her was just very, very empathic and supportive. And it feels, what you are saying is that you were actually feeling as if you were talking to a real mom in a real situation, yes, which is probably how you feel in your everyday life when you do these interviews.
Yes.
Yeah. And how do you think she responded?
I've administered the screener before, and different people react differently. It depends on, if they have had some exposure or what their child has gone through. I definitely have come in contact with people that, were very emotionally distraught because of the questions were so triggering. And then I've had people that just breezed through it and it seemed like it didn't bother them at all. So I feel that because of her own experiences, her response was appropriate.
So, I'm just thinking that right now we are introducing the TRIADS framework as a new approach to screening and response, where we are hoping that the screening will become a more personal experience for the patient and for the provider from the beginning. And so I would like to ask you a couple of questions about your choice of words and thinking together with you and getting your input about how we can think about the introduction of triads. What do you think of the use of the word adverse? I realize that we are talking about adverse childhood experiences, but I'm also wondering about translating from the medical sphere to when we're actually talking to patients. Do you think that the word adverse is still the preferred word to use, or do you think there might be other words that are more user-friendly?
It's funny that you should say that, because as I was reviewing this, I was thinking about that word adverse and wondering if, if everyone would actually know, exactly what that word means. It kind of sounds a little negative. So I do feel, even though it is what it is, but I do feel that there's probably other words. I can't, off the top of my head, there's not one coming to mind, but
yes,
I feel like we could, in explaining the screener, or if there's another term, other terms that we could probably use in the place of that.
Right. One word that we've used, and I'd like to ask your feedback on how it comes across in a medical setting. A couple of words that people have used are words like difficult experiences, yes, or scary experiences. How do those words, you think, would come across to the patients that you see?
I really like the word difficult. Yeah, I think that would be a good word to use. Scary is okay, but I think I like difficult better.
Scary infuses already an expectation, doesn't it?
Yeah.
Whereas difficult is more open-ended.
Right.
Yes.
In going over it and reviewing the video, I noticed that it used the word detect. So I was gonna maybe try to use that word instead, as opposed to,
Interesting.
I think what I said was to catch any of these adverse.
So interesting what words do, huh? They have a lot of power. And I was thinking, for example, when you said that that you were trying to forewarn her because these are tough questions.
Yeah.
I was wondering about your intention.
Okay, so there, you know, when you look over the screener, there's things about different types of abuse or whatnot. And so just trying to sort of prepare the parent for what they're about to read, you know. So it was just, I felt it could be a really uncomfortable situation, especially if I'm present with the patient.
Yes.
And so it's just sort of an attempt to, you know, let them know that they're gonna, you know, see some pretty tough, that's another word that I like to use, you know, questions in there.
It's like you were trying to let her know that you know how it might feel.
Yes.
So it was a protective intent
Yeah.
on your part.
Yes.
I hear you. Yes. How do you think she responded to it?
Yeah, well, when I did say that, I felt that she heard me and she was like, tough, you know, kind of like, oh, okay. And she reacted how I thought she might. So I felt that the forewarning was necessary.
Was well placed. In a way, she did. Do you think that maybe that is actually what enabled her to say these things did happen to her? That you were giving her a message that it was okay to acknowledge it, kind of?
Yeah. Yes.
Yeah. Is there anything that you want to add or recommend as we introduce the triad to other providers who are less skillful and less experienced than you are?
Not really. I think the empathy goes a long way. And I think that all, you know, the providers or staff or, you know, need to be willing to show that. I think that we can get a lot more out of the parent is if they feel comfortable. You know, it's kind of all about that provider patient relationship. I think the more that the parent feels comfortable, I think they'll be more willing to open up. So it's all about the approach.
That makes a lot of sense to me. Thank you so much for this conversation.
You're welcome.